your name, affiliation, role, and region in the chat. That will help us immensely. So we have a great lineup here today. So today we'll be joined in just a few short minutes by Carol Langodden, who is the Executive Director of the Lamoille Family Center and a member of the Vermont Parent-Child Center Network. Janet Kilburn is the Early Childhood Director for Family and Child Health at the Vermont Department of Health. And Dr. Brina Holmes is a general pediatrician and the professor of pediatrics at the Lerner College of Medicine at UVM and a senior faculty at the Vermont Child Health Improvement Program. And I realize I forgot to introduce myself. So for those of you who don't know me, I'm Elisa Stolberg. I'm Director for Family and Child Health at the Health Department and have been partnering with the Blueprint team over the last 2 years to implement the Dulce program, which you're going to hear about in a little bit through the Blueprint for Health, as well as some work that we've done together to on this pediatric training. So I'm excited to be here with you today. So just really quickly, for those of you who need a reminder or who weren't here last month, this is part of a year-long learning opportunity and quality improvement focused on pediatric best practice, office systems design, and connection to Vermont services and support. And so we are working hard to support or to wrap around the Blueprint expansion, really with some pediatric focused opportunity, in addition to the expansion of staffing and the focus on screening. We're really trying to support you all in having information and resources to be able to support families in your practices. And then this is just a quick look at the training series. So last month we talked about promoting lifelong health with an with a relational approach. There is a Blueprint sponsored Touchpoints training that will be happen in January and February. And if you're interested, you could reach out to your Blueprint program manager or the Blueprint Central Office team, and we'll get you connected to that. Today, you're here for Medical Home and Early Childhood System Partnership. And November, we'll be looking at developmental screening, assessment, referral, and all that great stuff. So without further ado, I'm gonna turn this over to Carol Langodden, and excited to be here with you all today. So thank you.
Thank you so much, Lisa. Good afternoon, everyone. I didn't really know what to expect, so seeing so many familiar faces is nice. Unfortunately, I just want to warn you, you are going to be stuck listening to me for a good chunk of this. And so I'll do my best to keep it entertaining. I think we all know sometimes multitasking happens during these kinds of meetings. So I'm going to do my best to keep it entertaining. So our objectives for today, what we hope you get out of this, is one, that we introduce or reintroduce you to key partners and programs in the early childhood system who you may interact with. We hope we're able to share examples of successful integrative models with all of you, and we hope to hear from some of you about others. And then also hoping to identify opportunities for medical homes to leverage early childhood experts in their region for team-based care and that continued collaboration. So next slide, please. And so starting right off, we're going to have a little bit of a game. What I'm going to encourage you to do is to enter into the chat what you believe the answer to be when we throw up some of these jargon busting things. I think a lot of statewide efforts, we see a lot of initials for things, and sometimes those initials make no sense to anyone. And so, Elisa, I think, are you you have the power to slowly advance this?
I do, yes.
Okay. If
I
you could
think.
do the first one, this will be time trials. And so essentially when the jargon, when we need to solve it, it'll pop up and I'll have the first person to enter into the chat. Oh, Rachel. Okay. Rachel's the winner already. CIS stands for Children's Integrated Services. I'm guessing a lot of you knew those. PCC. Oh, Julianne entered. Who knows what PCC stands for? Parent Child Center. Okay, we've got VCHIP folks who are winning the race so far. Next one, please, Elisa. EI. What could EI possibly stand for? Early intervention. Thank you. Oh, look at all the answers coming in. Thank you. A lot of people knew that one. Excellent. Early intervention, which is a program of CIS. Strong Families Vermont. This one's a little bit a trickier one, probably. Does anyone know what Strong Families Vermont is? Home visiting, CIS nurse program. Thank you. All correct answers. Prizes will be not awarded because there are no prizes. Next up, please. BBF. What could BBF stand for? This one could be tricky. Building Bright Futures. Thank you. Good job. Not to be confused with the Bright Futures from AAP or the Bright Futures Information System, which is a childcare system. We've got a lot of smart people here and people who are paying attention. I appreciate it. WIC. Does anyone know what WIC stands for? Thank you, Liza. You got it. Women, Infants, and Children, the Supplemental Nutrition Program for pregnant people and children up to age 5. Okay, next. HMG. I almost just set it out and was going to tell you exactly what it was. Help Me Grow. Again, VCHIP is pulling in the lead. If I had to look through these, I think VCHIP might be winning. Thank you. And next, Dulce. Does anyone know what Dulce stands for? Oh, come on, people. Someone out there, not a Dulce family specialist. Rachel, I feel like it's cheating that you responded. John, thank you. Excellent. Folks did know it. All right. Next up, and the final one, ECFMH. What ECFMH stands for. This one's really testing you. Yes, Liza, I would have imagined would have known that one. Thank you. So Early Child and Family Mental Health Services, which is also a part of Children's Integrated Services that we will hear about later. So I think as we think about these initials, it's confusing for all of us. It's equally as confusing for families. So the more we try to catch those and figure out what they mean and explain it to families, I think it's incredibly helpful. All right, next slide, please. All right, so this list is a short, I'm sure there's more, but a list of who we sort of think of are some key early childhood systems partners in each region. And so I'm going to give you just 2 minutes to think about it. There's no quiz here. You don't have to respond in the chat. I just want you to sort of look at these titles and think in your own head whether in your own particular region you know who these people are or you know where to look to find who these people are. So CIS coordinator, so Children's Integrated Services coordinators, PCC, who is your local parent-child center, WIC, who is your WIC contact, the FCH coordinator, who's your family child health coordinator in your region. Oh, Brina's thrown in that you could consider this a scavenger hunt, and you totally could. This I would be willing to give a prize if anyone were to email me afterwards that they have identified all of theirs. I would send you a prize. So the first one, I can't give you all prizes. BBF, who's your Building Bright Futures regional coordinator? Who's your childcare resource and referral agency? And also, who is your Help Me Grow child development specialist that you would call if you had questions specific to your region? So this is homework. I bet you didn't think you were going to get homework today, but this is your homework. And maybe there's even a prize for anyone who happens to rattle all of those off in the chat before the end of today. Okay, next slide, please. So we have this beautiful map here that I hope will help you as you think about some of those regional questions and who your regional partners are. So parent-child centers, there are 15 parent-child centers across the state. We're divided in Agency of Human Services District, and each parent-child center is really tasked with legislatively with supporting families and children throughout the state. And so the key on the right, I know it's really small, and I imagine you're going to get these slides after, but it helps sort of map out where each parent-child center is and the names of them and what towns they actually physically are in. I was shocked as I looked at this map to see how big Northeast Kingdom is and what a large region they cover. And it just sort of helps sort of pinpoint who your regional parent-child center is. So next slide, please. So parent-child centers are really sort of the service hubs for families in their areas, anyone with young children. We always seem to have sort of open door policies that most people in our community know to come to a parent-child center if they have questions around parenting, if they have questions around child development, if they need a play group, if they're looking for any kind of parent education opportunities, if they need help with diapers, if they need help paying their bills. Parent-child centers are sort of the hub for those. We were established in statute in the late 1980s and then further codified with Act 150 in fiscal year 23. So there's 15 community-based family resource centers located across all 12 regions in the state. And we're tasked with delivering 8 core services. And these 8 core services are listed further in that I'll talk about. But what I can say is each of those family centers and the parent-child centers delivers those 8 core services a little bit differently based on what their community needs are. And I think that's one of the things that makes parent-child centers unique, is that we can all sort of collectively look at what's happening in our community and where might we need to support families in additional ways. So next slide, please. Thank you. So these 8 core services are listed in the white font. So parent support is one of those, home visiting, play groups, information and referral, early childhood education, community development, concrete supports, and parent education. And again, like I said, these look a little bit different at each parent-child center, but the hope is that we are all adapting each of these to support all families in our communities and also early care providers who could benefit from some additional support. And so some numbers from our last impact report, over 18,000 children served across all 15 parent-child centers, and almost 18,000 parents. And we use parents as caregivers. So it may not necessarily be mom and dad, it may be grandparents and other caregivers. And so a little bit about some of the 8 core services. So parent education can look different. It could be that there's support groups happening. It could be that there's specific topics being shared out with families. It could be driven by, again, a community need. What's popping up in our community that we might need to support families around? And then concrete supports is one. I think PCCs are really exceptional at helping to support families with some of those basic needs that when we look at a social determinants of health screening, we know there are some concrete supports families might need help around paying an electric bill, around gas cards, grocery cards, those kinds of sort of basic needs that they may need some support around. And then play groups are a huge piece of what parent-child centers do. And it's a lovely way for collaborations to happen as well with those play groups. Sometimes they're happening in collaboration with libraries. Sometimes they're happening in collaboration with other groups in the communities. So next slide, please. And this just lists them out again so that you can see them. And again, I think as you think about your own regional parent-child centers, you may have some examples of where things like this are happening, where community development is happening, where parent education is happening, and where families know they can call to ask about a service. And it may not be a service that parent-child centers offer, but they typically know who in their community does offer that resource, and they can make those referrals to families. And so one, I would encourage you all to sort of check out parent-child center websites, look and see on that map who is your area parent-child center, and check to see what they offer, because I think that's one of the things I'm often struck by when I meet with family to talk about what we do here at Lemoyle Family Center. People are surprised to know some of the things that we do and didn't realize everything that we offer. I think there's a misconception that parent-child centers are childcare centers. And some parent-child centers don't even, in fact, have childcare centers. We're doing support in the community with area early childhood educators, but we don't actually have childcares. Does choice of PCC depend on family's address for those of us working on the corner of 4 counties or PCCs? So it really depends on the address where they live, typically. There may be some flexibility, and I think that's, again, where parent-child centers are good at supporting families with needs. So typically, I would say start with a PCC in the town where that family lives and who covers it, and then see, is there something else and something different? There will be some very specific things like Children's Integrated Services that has to abide by what town that family physically lives in. But I think there can be some flexibility in that. And hopefully that answers your question. Next slide, please. Thank you. So again, like I've mentioned, parent-child centers are really good at responding to community needs. And I think they're really open to responding to community needs. And so one of the things we saw in particular around flooding this past July and the previous July is that those towns most impacted really had to sort of step up and think outside the box around how they were going to support families. And so some set up individual funds that they knew they would strictly use for flood relief for families who had been impacted. And some set up funds that they knew, okay, 6 months from now, when a family has lost everything in the house in the floods, how can we support them even 6 months from now? Not just in the immediate, but how are we going to also wrap around this family 6 months from now, a year from now? I think there's been other areas that we've really looked at. Food insecurity is one of those that a significant amount of our families struggle with. So we've really tried to look at who are the people in our community who are also seeing this, and how can we work together to support families around this? Is it opening a food shelf within a parent-child center? There's a number of parent-child centers that have food pantries that families can access. And I think also looking at who are our area medical providers who may have food pantries. So again, I think it's that need and continued effort to collaborate with one another to sort of meet the needs of families and ongoing issues that come up for them. Slide, please. So I think parent-child centers, I mean, we've been around a long time, dare I say almost as long as I've been around, not quite, but close. And so PCCs have worked really hard to sort of leverage the work we do to build strong relationships that better serve our communities and the families and what they may need. It's about that local partnership, but it's also about statewide partnerships and how do we continue to work together as a whole network to support everyone around the state as best we can. And I would say there are some key programs that have definitely helped enhance and support the early childhood system. Dulce and our partnerships with parent-child centers, healthcare providers, and Vermont Legal Aid is one of those examples that Brina will talk about shortly. Children's Integrated Services is one of those sort of statewide programs that really has an emphasis on families and how best to support them. And then the Child Care Referral and Financial Assistance Program, which again is another one that really works to support families with children. And so I'm going to pass it off to Brina for the next couple slides to talk more about Dulce.
Thanks so much, Carol. Thanks for bringing fun energy during the noon hour here. A few sentences before we do a slide or two on Dulce. So I hope that what you heard, and many of you were with us at the kickoff last month, there's a lot to be said here about relationships. And I do uh, recognize that every region's different here, but the bridge between medical homes and parent-child centers is not as strong as we would like, and as would be best in service of children and families. So we wondered together about what would work in that space. Do you want to set up weekly, monthly, quarterly conversations now that we have all this great technology with Zoom, with your medical home connecting to the local parent-child center? Do you want someone in your office to be an early childhood kind of hold the info person? Do you want to build team-based care around someone that's already part of your team who has special interest in this area and might want to be the bridge or the representative between these two places? And the example we give all the time is, if a pediatric pulmonologist calls down to a pediatric office to follow up on something, we have a system for that in pediatrics where we're like, interrupt me, I got to talk to Tom Lahiri. And we feel that the early childhood expertise of parent-child centers would be as helpful to your patients and families as that. So who is it at the parent-child center that can bridge over to medical homes and bi-directional as well? The second thing, I'm so glad Sarah Morgan brought it right up. The map is complicated, and I hope you know the humor here that hospital service area and the Agency of Human Service regions are a little different, and regions that have 4 or 5 parent-child centers will have to attend to that, as Sarah asked. And I do recognize that's a little bit of extra work. And again, if there was someone in your practice who knew the zip code lineup of each parent-child center, it would be helpful. And then the last thing I'll say, heading into Dulce, is Carol Angon and her team at the Lamoille Family Center are a perfect example of getting to the yes. And this is also about relationships, because in 2017, the parent-child center leader at Lamoille, Scott Johnson, said, it seems like pediatric healthcare is starting to build capacity for wondering about housing, food, violence prevention, substances, mental health. And many of you were around back then. And he got nervous that they were going to build it in the health system. And he said, that doesn't seem like a good use of expertise for the littlest. And he knew about the Dulce model because he was working nationally. So he called at the time Appleseed Pediatrics, now Lamoille Health Partners, and said, I have a person for you. I'm going to give you a full-time family specialist to come meet every single new baby in your practice to build our bridge between our great organization, Lamoille Family Center, with all the expertise, and this incredible opportunity in pediatric healthcare that you're seeing every new baby, because we have high, high rates of well child care. So that's what Dulce is. The legal partner piece was added as well, which it turns out to be incredibly valuable to understand a different way of thinking about family needs. And the medical brain is one thing, and the legal brain is another. So most of you know Dulce, but it's universal approach. And it's just for the first 6 months, except some of our sites do find their way to the first year, and there's a lot of nimbleness and opportunity there. And the part that matters the most to all of us is that it's really meeting families where they are and recognizing that all families have strengths. And I will call out that we continue to leverage the early childhood system in recognizing through the medical home that we're not meeting the needs of families. So as much as that feels uh, upsetting to all of us, it's the way that policy gets shifted. So when the parent-child centers that do Dulce can say, I had 6 babies this week that had inadequate housing with a legal partner alongside for strength, that gets the attention of people in a way that we would normally have not found that out for several months or years hence. Next slide. Okay, and then the map, we're really proud of this. This has taken a lot of energy since that first day, 2017. And I think Jen Chittick is on. Our original family specialist is still our family specialist in Lamoille. So these 6 sites you see here, you're familiar with because we've been able to leverage the Blueprint for Health. And thank you so much for that partnership. And we're really proud of the efforts in those 6 sites. And then we also have a federal grant called Transforming Pediatrics for Early Childhood that has allowed us to expand to 3 new sites. And what's great about this slide is to just slow down for a second and notice the parent-child center representation and the way that we have partnered that great expertise and core services that Carol outlined with our very strong pediatric healthcare system in Vermont. And the people that, the architects of Dulce in Boston and the folks that hold it now at the Center for the Study of Social Policy are just astounded at what we've been able to accomplish with this approach in our great state. Next slide. And then I'll leave you with the family impressions. We do have qualitative evaluation from our medical professionals as well that will give you goosebumps. I'll start just by saying our pediatrician in Lamoille said, well, this is why I became a pediatrician. And without with the family specialist, I actually feel I go home at night feeling that I have accomplished much more than I used to. And I know most of us are very concerned about the pediatric workforce, and this is an antidote to the despair. So families say this could change your whole experience at the pediatric office by having a Dulce family specialist that makes it more warm and welcoming. And Dulce is more than a case manager or social worker. That's really important to me. The family specialists do not have to have advanced degrees or any initials after their name. They're people, humans who care. It feels like more of an extended part of your family. You feel like they just give you way more support. This program has made me feel safe, heard, and supported. I won't even read the rest. Dulce is a support person to help you transition into motherhood with all the challenges. And Dulce helps support you and makes you the best version of yourself. I don't know very many things in my 30 years that can say this. So I'll stop there. And I think I'm turning it over to Janet Kilburn, but it might be back to Carol.
Nope, you're stuck with me. Thank you, Brina. I want to add a piece just from a Lamoille perspective around Dulce, is just really how much we value that partnership we have with Lamoille Health Partners. And really, like, it is the true sense of working collaboratively to support families and leaning on your early childhood experts. And that's really what those Dulce specialists are. So thank you for talking so eloquently about Dulce. I get to talk about children's integrated services now. So again, this is another one of those systems that we have in Vermont already that really has that focus on early childhood. And dare I say, these CIS providers are sort of the experts on early childhood. And as medical providers, you want to lean on them and you want to make referrals. And I get another, I swear I'm not getting paid by Lamoille Health Partners, but another shout out to them who they make a strong amount of referrals for CIS, not just for early intervention, but also for parenting support. And so to think about ways that you can use your children's integrated services team is really thinking out of the box and thinking how to best support families, because CIS happens in the home where families are really comfortable. I think we all know sometimes it's not always comfortable in the doctor's office. And I could say that because I don't work in the healthcare field. So I'm sorry to everyone if I just offended you, but it can be tough sometimes. Someone wakes up, a 4-year-old wakes up on the wrong side of the bed. And if you've had a 4-year-old, that happens. And so sometimes meeting them at home where they're at really is the best way to provide some support to families. So this list, again, Brina said it really well. The map is confusing about where families should be accessing services and also where you all should be making referrals to. So hopefully I've made it a little bit easier with this map. I swear my IT department didn't help me and wouldn't help me. So I did this myself. I've listed out the current CIS coordinators for each region here. And I confirm with Keith Williams, who runs CIS of the state, that this is an up-to-date and accurate list. It got really lengthy as I tried to provide contact information. So that link below is actually where you might want to look, and it shows the towns that are covered in each of those. And we do have a list of the parent-child centers and the towns covered. So I can find that somewhere and get that out to folks to make it more clear. But so Children's Integrated Services, or CIS, is a statewide program prenatally up to age 6 that offers a variety of supports for children and their caregivers, and early childhood programs. So next slide, please. Let's see. So,
Yes.
oh, thank you, Elisa, for putting that in there. I want to make sure I didn't miss any other questions. And if you are not muted, if you could mute yourself, because I can hear something.
Carol,
all right.
there is a Dulce question that is right before it. I don't.
Oh, thanks. I didn't
maybe
see
you
that.
can answer afterward, but
Can medical homes other than those with embedded Dulce workers access this for our families? So good question. I wish I could give you an answer that is yes. I cannot. Somebody needs to mute. I do love hearing myself, but not that much. Thank you, whoever just muted. I appreciate that.
K. A is an apple, P is in Paul. 5, 6.
Oh, thank you. Now whoever it was is definitely muted. Okay, so no, the long and short answer is no. However, there are other services that we could help provide, though it's not Dulce. But this might be a future thought for how much further can we expand Dulce, which I love that idea. So we should talk more about Dulce expansion too at some point. But to CIS, and Dr. Morgan, I'm sorry if that didn't give you a great answer, but feel free to let me know if you have more questions. So Children's Integrated Services, again, like I already mentioned, home-based visits. We still are offering some virtual visits, although I would say since the pandemic, the bulk of services really are happening in the homes. Or a location of choice. Sometimes families don't want a home visit. They want to meet at a playground. They want to meet at a library. They want a home visitor to come with them to a playgroup because they're not 100% comfortable going by themselves. So that's where CIS can sort of step in and help offer those additional supports. And based on the different services, will depend on what a visit schedule looks like, whether it's weekly, twice a month. It really depends on the child's needs and the family's needs to determine those. And then for each, there's usually some type of validated screening or assessment where we're looking at development, we're looking at social determinants of health. We're really trying to get an overall picture of the family. It isn't just focused on the particular child who we got a referral for. It's really looking at the whole family and how can we support that whole family. And then definitely referrals and connections to resources, ensuring that families have access to the services they need and that they're aware of them. And sometimes we find families aren't even aware of a service they might be eligible for, that they might really benefit from.
Hey, Carol.
Hey,
Oh,
yes,
Carol, I just want to, someone said I could do some color commentary. So
totally.
For my medical provider pals out there, so we did a survey a few years ago. Many of you think CIS is just early intervention. So this slide needs to be screenshotted or perhaps laminated and put on the wall of your offices. And then the second piece that I really want to acknowledge, and Carol's a great champion for, is when you send a referral to CIS, we do know that sometimes the communication back isn't adequate, and we work on that very significantly, both at the state level, but also at the local level, but that's relational as well. So if you're feeling like CIS is mysterious, or it's just for early intervention, or you've sent folks there and never heard back, we can hold all that with you, but we want you to keep trying.
Yep.
And I'll go back to Carol. Yeah.
Yeah, for sure. Thank you. Yeah, and so those services that are in those beautiful squares, one, you certainly could take a photo. And I'll tell you a little bit about each of them, but sort of all of CIS really does focus on this like developmental centered parenting, supporting parents to be the best that they can be, perinatal mental health, and then just some general like best practice things people should know: safe sleep, preventing child injuries, a focus on nutrition. There's just sort of a variety of things that anyone could ask for support around. So next slide, please. Let me just, yeah, I want to touch, can you go back one slide? Sorry, I rushed things. Sometimes I'm just too fast, that's all. So early intervention, like Brina said, sometimes medical practices only think of EI when they think of CIS. And one, I'm grateful that you think of EI, because the earlier we get those referrals, the earlier we can make a difference for children who have some type of developmental delay. So early intervention serves those birth to 3 with a developmental delay, a medical diagnosis that might put them at delay. And we're really fortunate in Vermont that the eligibility, it's pretty easy for kids to get services. And so I would encourage those on the call not to say, let's wait for the next visit and see. I would encourage you, if you have any concerns or a parent has concerns, just to go ahead and make that referral and we can see about services. That's a full assessment. We work with kids until they turn 3, and well before their 3rd birthday. If it looks as though children still need services, we're connecting with the school system. So the Part B services that would continue to deliver services. Sometimes I think where there can be confusion, especially when a child's close to turning 3, you see a kid late for an appointment, they're really close to 3, and you're worried about development. Send them our way still, even if they're close to 3. We prefer to see them earlier, but send them our way still. And we can help determine with the family and the school, like, who it makes the most sense to make that referral. And then I would say, if you've got a 3-4-year-old, someone past that early intervention age, it's okay to still call CIS, and we can help sort out where that family needs to go. Because I think that's another one of those really confusing, like, which supervisor union do I go to? Where do I connect this family for developmental support? So still call the CIS team, and they can help sort it out. Specialized childcare has a couple of different focuses. So one, it's around supporting and enhancing the quality of childcare providers in the area and supporting that group of people. It's also about supporting children who may be in custody or at risk of coming into custody to access childcare more easily. So there's sort of a protective service component to the specialized childcare world of CIS. And then some of you, I hope, might be familiar with getting a request from a child care financial assistance office to sign like an adult with special health needs form to help someone access childcare. So there's a piece of childcare where we're helping folks have an eligibility for childcare, essentially. So specialized childcare has everything to do with all the early childhood programs going on in the area. And then there's early child and family mental health. Based on sort of where your agency is, you may be providing that service directly out of your own agency, or you may be contracting. So for example, in Lamoille, we contract with Lamoille County Mental Health to provide our early child and family mental health services and home visits. And that's really around the social, emotional development and well-being of the children, and also supporting parents around parenting and helping those children. There's a component where there's some overlap in childcare. So we're also trying to support childcare providers and early educators around social emotional development for a child. And then strong families around. So that I'll talk about a little bit more on the next slide. But what I really want to emphasize about the CIS team is that typically, and again, it looks a little bit different in every region, but the theory is there and the work is there, is that all of these case managers and all of these sort of team leads for CIS are coming together weekly to go over referrals, to check in about services and to make sure families are getting what they need. And so, as Brina said, if you have made a referral and you have not heard back, it's okay to call the CIS coordinator and ask what's happening with that referral and where is that in the process. Ideally, once we have a referral, we only have 45 days to put a child onto what's considered a 1 plan here in Vermont. And so, we want to be timely and we want to not have families waiting. So next slide, please. Good thing I went back to that one. I had a lot to say. Is everyone still awake? I hope so. I can only see Brina's face. So I do know Brina's awake. So that's good. All right. And so next up, part of Children's Integrated Services. Thank you. Elisa's awake. She's at least sent an emoji. This can also, I think, be a little bit confusing, that Strong Families home visiting is part of Children's Integrated Services. And so when you are making a referral, you certainly can put on that referral what you are specifically referring someone for, but it's also an opportunity for whoever is taking that referral to talk to the family about what it is they're looking for and sort of to go over this list of early childhood services that are available. And so we have sustained home visiting, we have responsive home visiting, and we have universal home visiting within Children's Integrated Services. And so the sustained models, much like the name would lead you to believe, are slightly longer programs. So those are a long-term curriculum-based, typically home visiting program for families. So MESH is an example of that, and Parents as Teachers is an example of that. And so there's the family support piece of it, and then there's the nurse home visiting piece of that. And I think if you have any question about whether a family could benefit it, I think it's okay to talk to them about it, get permission, and make the referral. And we can check in with the family about which program sort of meets their needs and their lifestyle and what works best for them. So, but we have those. And this link will lead you to more all about all of those CIS services that I bet Elisa's about to put into the chat.
And Carol, I'll just add into, so folks, that each one of these things that Carol's talking about are their own talk, so we're really compressing, but home visiting has 30 years of research and data that would blow your socks off. And we actually have learned through our very rigorous data collection and Elisa's team that Vermonters accept home visits at higher rates than other, national averages. So if somewhere in your brain this isn't coming to the forefront as an effective strategy, or thinking, well, folks aren't going to want that, which, I was guilty of wondering about, I would reframe that for you to say that not only is in the sustained space, the intervention actually changes the trajectory of the child's life all the way through. So the data shows the kids are more likely to graduate high school if they had this experience in their first 2 years. They're less likely to be incarcerated. I mean, there's so much to say here, and yet it sort of gets downplayed in our array of interventions. So I just wanted to get us back excited that Vermonters really welcome home visits and home visiting. Sorry, Carol.
No, that's totally fine. I think this is one piece where we know how busy medical practices are. And so this is that piece. Can you make a referral to CIS for a family that's going to help strengthen the relationship? And I think, I have CIS providers who have driven families to doctor's appointments to help them understand things, to help one, get them to an appointment because maybe they're overdue on a well child check and they really need to get their child to the doctor. I mean, that's a piece CIS can help with. Like, we want to wrap families fully in that sort of case management. How do we support you to be the best parent you can be? Is there insurance piece to Strong Families? I'm going to let Elisa answer that because I feel like that's probably, I don't think I should be answering anything about insurance.
Sure. So it's a little bit complex. So the nurse home visiting program is federally funded, and it is for individuals who are eligible. It doesn't mean they actually have to be receiving, but they're to be eligible for Medicaid. And Parents as Teachers is a Medicaid, or the Family Support Home Visiting Program is a Medicaid benefit, and so families do need to be receiving Medicaid. Responsive home visiting is a little bit different, and that generally speaking, Children's Integrated Services, or the responsive home visits through CIS, is billed with Medicaid, but there is an allowance for families who are not receiving Medicaid.
Yeah, and thank you, Lisa. so the CIS portion, I can tell you, maybe I'll get in trouble because it's recorded. If I do get in trouble, I'll blame all of you too. But so I can tell you the CIS, it's, we can bill 80 up to, really we could bill 100% of our CIS clients as Medicaid if they are. The goal is that we aren't supposed to do more than 20% who are privately insured. There are regions who are doing more because it's the right thing to do. And so there are probably some regions not getting reimbursed to see children because it's the right thing to do. It's to see a child who needs it. And so that's not going to be probably every region, but it's, if you have a question about a family and their insurance, it's worth making that referral and having the CIS coordinator try to figure out how we can offer some supports. And again, I think that's where we're good at sort of thinking outside the box and problem solving. Because if we can't support someone, is there something else that we can try to offer that family in terms of resources and supports through the Parent-Child Center or through another agency we might work with?
Carol, did you also say this? I'm sorry if you did, that early intervention is a federal entitlement. And so
yeah. I didn't say that.
It's available for any family,
yeah,
regardless of insurance.
Yeah, thank you for clarifying. So EI is for everyone. We can't have wait lists for early intervention. So yes, make those referrals and families can have all the services they need there without paying. There are some situations where families may have gotten a bill and we typically are able to get that to the state for payment or for reimbursement. Occasionally that comes up here and there, but yeah, all families, it's part of FERPA, federal education rights. So yes, that's accurate. Okay. Do folks have maybe we'll save it towards the end, but if anyone has a real burning question about CIS, yeah, Liza is saying it is available if there are employees, and that is accurate. There for sure right now is a shortage of SLPs, PTs, and OTs. We're all struggling, I would say just about every region for SLPs, PTs, and OTs to see children. And that's perhaps one way we could think about, are there ways we can be collaborating if you know of folks who may be able to see early intervention age children. So that's the birth to 3 kiddos. Thank you, Liza. Are the PCCs well stocked with diapers right now? I haven't had much luck in the past referring people. Yeah, so when the diaper bank that the Junior League of Champlain Valley, they had really advocated in the legislature to get funding for more diapers. That program started probably before COVID, but it spread during COVID to be statewide, where we all were really benefiting from those diapers. And they were not successful in the legislature in getting more funds. And so what did happen is a small amount of money was given to the food banks to supply diapers. Food banks felt like parent-child centers were better equipped to be getting diapers out to families, so sent that over to us. I think we're running pretty low on that stock, I would say, Jennifer. I can try to get a final number. There are some available, but yes, if you're looking for diapers, call your local parent-child center and see if they have any. Have families call. I know here in Lamoille, we still have a pretty good stock, although I just think I heard we're out of newborn diapers, but we also typically have funds. I can't speak for all parent-child centers about how they direct those funds, but we do have some funds that we can use for concrete supports for things like diapers. So I can't say it's well stocked, but there is some stock there. Yeah. Okay, next slide, I think. So the other thing I wanted to mention was that most PCCs, not all, I will say, are the fiscal agent for the childcare support services, so childcare financial assistance programs and childcare referral. And I suspect most of you are aware of Act 76, which increased eligibility so that more families could access childcare financial assistance, which has been phenomenal for families. So just about all PCCs house that support. So that's another way I think we could think about together supporting families who are looking for childcare. They could call their local PCC, or again, I've got the link in this slide, so you can figure out who your local childcare referral agency is, so they can help families find childcare and also help them figure out whether they potentially are eligible for childcare financial assistance through the state that will help them pay for childcare. So this is another one of those, I think, childcare is a significant stress on families. And so anything we can do to reduce stressors for families so that they can continue to be good parents and not be really stressed. And probably many of you on this call have struggled to find childcare. So looking to your PCCs to find out who the childcare support service is. If it isn't them, they should all know, but there's also this list here. I think the only other piece I want to add about a lot of these too is if you are not sure, one, you certainly can call a PCC to try to figure out the answer to where a resource may be, whether it's childcare, CIS, diapers. You can call a PCC, or this is going to be a perfect segue. You could also call Help Me Grow. And now Janet Kilburn is going to take over, and you don't have to listen to me talk for at least 4 slides. You're welcome.
Awesome. Thank you, Carol. What a great intro, and so good to hear all about CIS. And Help Me Grow refers to CIS. It's really our job to drive referrals to CIS. And if we were in a room together, I would say, how many of you have heard of Help Me Grow or made a referral to Help Me Grow? Could you raise your hand? So if you don't mind, could you give me a thumbs up or raise your hand virtually just so I could get a sense? Awesome. Okay. Great. So some of you aren't as familiar with Help Me Grow, so I'm glad you're here today and to have this opportunity. All right, so what is Help Me Grow? We are a statewide resource for any family in Vermont, prenatal to age 8, available Monday through Friday, 8 in the morning until 5 p.m. You can leave a confidential voicemail. We'll call you the next business day. And we do serve families with older children as long as there is a sibling 8 and under. So we are a one-stop shop for Vermont, and it's one number. We partner with 211 with their resource database. We have access to over 3,000 resources and programs that we refer to through that database, and our child development specialists are certified through the Alliance for Referral and Information National certification. So these are many of the services that we refer to. And again, it's 211 option 6 is the number, but this is the link to the referral form. So you'll see Children's Integrated Services, and we have traditionally referred a lot for early intervention services to CIS, but this past year we've really been focusing with some quality improvement efforts on increasing referrals for home visiting for the Strong Families Vermont, both nurse and family support. And we have really done that, and we're excited to connect more families to home visiting services. You'll see also perinatal support treatment resources and treatment for substance use disorder during pregnancy. We have added to our database clinicians trained in perinatal mood and anxiety disorders, parent-child interactional therapy, online, like Postpartum Support International online chat and forums where families can get supported, as well as virtual support groups in Vermont. And we keep pretty detailed information on some of these clinicians so we can better connect families when they have openings, such as the languages spoken. Do they offer evening sessions? Do they offer childbirth classes? Are they on the bus line? So we're really trying to shore up that connection because it's so hard to find mental health services, and everybody wants their own therapist. So that's, again, we're home visiting, because our nurse home visitors are trained in postpartum support international interventions. That can be a huge positive resource for working with folks in the perinatal period who might have some anxiety or depression going on. So we offer developmental screening. Again, we refer to childcare, and that can be to those childcare resource and referral agencies, what Carol was saying, but and basic needs. We try to hold families, if you will, while we work with them. And this can be really beneficial. Let's see, next slide, for the referring provider. So this is like a graphic of what happens if you refer or if a family calls themselves. We will assess the need with the family or through your indication on the referral form, and we will refer to service, probably multiple services, and then we follow up with the family And that is a key thing because we don't want to lose families. We don't want them to fall through the cracks if they're waiting for like a home visitor from CIS to come out and there's staff shortages. We want to hold those families while we're working with them. We also want to call the referring provider back and let them know what we've done with the family. So at the next well child, you know that we've referred the family for these services and they've gotten connected to one or two of them. So that's an essential service that Help Me Grow offers because we have a trained child development specialist sitting by the phone Monday through Friday, 8 to 5. And CIS is often out doing home visits and they have a myriad of other duties. So we're trying to be a backup and expand some of those gaps for our CIS system. The other thing that we had is like callers can remain anonymous. So if family calls, we connect them to resources with just sometimes their first name. So if they're looking for substance use disorder treatment or they just are leery of systems and they don't want to give their name, we often hold that family for a while and usually build a relationship so that they do give us demographic info eventually. But that's another way that we support families. Okay, next. Oops, can you go back one? I just want to.
I'm trying, Janet.
Oh no. Okay.
Sluggish.
Oh, perfect. So we have family-friendly materials. Some of these are from the Center for Disease Control and Prevention. Developmental milestones at a glance for families. They're wonderful. They have learning activities. You can track your child's development. We've co-branded them with how to contact Help Me Grow. And we have some limited inventory on these baby board books, which are wonderful, as well as some books for 2-year-olds and 3-year-olds. But if you're interested and need materials for your practice, please reach out to this Help Me Grow email and we will ship them directly to you. Okay, next. All right. And yes, Elisa's putting a reminder that the next session is going to be all about developmental monitoring and screening. So you'll learn more about these resources and how they can really support your efforts to monitor kids' development in your practice. Okay, so building bright futures. This was the jargon buster at the beginning, not to be confused with AAP Bright Futures or Bright Futures Information System for the childcare, finding childcare. But this is our early childhood state and regional councils system that are instrumental to driving forward our vision for early childhood and implementing key goals that are determined by early childhood professionals in the state and with lots of collaboration from many, many programs and providers. So you might not know your Building Bright Futures coordinator in your region, but they're out there doing great work in partnership with the health department, PCCs, CIS, everybody is really working together to make sure for the number one goal of our early childhood action plan, all children have a healthy start. Building Bright Futures is centered on data and making sure that we have data to tell the story. Are we making a difference? And part of this is driven by our action plan. I referenced it, but this action plan is a 5-year vision that is driven by community partners, and many of the strategies you're hearing about today are part of that action plan and are evidence-based and are key priorities of the state under that plan. And I think that's it. Are there any questions?
You're stuck with me again. One thing I will say, just to add on to the BBF, I'm on the VCAP committee right now, and we're working on the next action plan. And so, just a plug for one of the things that we're hoping to do is really try to go to places where parents, caregivers are, and ask like what currently works for them about our systems and what isn't working. So if any of you have any brilliant ideas about where we could access families that maybe we haven't thought of, I'd love to hear those. So you can all email me later those great ideas. Thank you. Okay, next slide, please, Elisa. Okay, Good. It doesn't say breakout rooms on here. I was worried people would see that and they would instantly leave. I have tallied up right now. There are 40 of you here in this space. I would like to be the first to say that when I hear there will be a breakout group, I often I have to go to the bathroom, or I got to run downstairs, I got a cup of coffee, I'll skip the breakout. Please don't skip the breakout, because we really want to hear from you about what's working well currently between our medical home and early childhood system partnerships. So you could think about this early childhood systems we've talked about, CIS, Dulce, child care referral, anything, parent-child center connections. What's working well about your collaboration from your medical home with those systems? And what's been a challenge? Because I think this is the piece we are down to 38 people. I just want to say 2 people have already left, and I am watching the numbers. Okay, 2 people have already heard breakout rooms, so they're out. I didn't sell it. What's working well about those current systems, and what's been a challenge? And if you have ideas about how to sort of surpass those challenges, or if you just have any brilliant ideas. So Elisa is in charge of breaking you. Oh, and a third question. What do you want more information about? Since we blew through so much today. That's right. I talked too fast. Okay, 3 questions now. So Elisa is going to, is it possible to print off the PowerPoint presentation? I would look to, probably, I'm sure. Elisa, they'll be able to print when you send
We'll
it.
get it out to everyone, yeah, or it'll be on the blueprint site. I'll talk to the team and we'll figure it out.
We'll figure it out. I'm also happy to come out and do the whole thing over again if someone wants me to come present again. I'm happy to do it. All right, so Elisa's going to be in charge of breaking you out. I don't know how much time you're going to have. Elisa, how much time are they having?
Like 10 minutes, maybe?
Okay, 10 minutes. 36 people. We're down to 36 people. Okay, you've got 10 minutes.
Oh, this is the funniest thing I've ever witnessed, even with your
I know,
preamble.
even with me saying don't leave. It won't be painful. We want to hear what's working well, what's not. So you have 10 minutes, maybe a little bit less, we'll see. And down to 35. If you could choose one victim to report out, one reporter to report out to us, that would be great. So Elisa's going to break you out into groups before anyone else. 34. We're down to 34. Before any more people leave. I should have kept track of who the people were so I could send them an email after. All right. Elisa, quick, before anyone else. 31.
I'm working on it. Well, no,
Oh,
some
no,
of them
she's
are
sending
leaving and
people.
going to the breakout
Oh,
room.
panic.
you. Okay, good. Oh, man. I was like, they're doing it just to spite me now.
So adorable.
Oh,
Carol,
wow.
You did it. Carol, you have to be a professional presenter. I've never
Oh,
seen you in
God.
this exact setting. You're so
No.
good.
I
You were
know.
really good.
I do
Yeah, you
horribly
were.
right in the very beginning. Oh, some people are they coming back to us?
I don't know. I can reassign. Oh no,
Hi,
Sorry, it
Michelle.
kicked me out and then asked me if I want to join again. I don't know if it reassigned me.
Oh, you'll have to listen to our
that's
whole
so
presentation
weird.
over again. Just kidding.
I don't know how to read. Well, maybe, hold on 1 second. I'll try and do it.
Okay. Oh, at the top it says join room 1. Should I click
Oh,
on
yeah,
that one?
you should
Okay.
do that. Yes.
Thanks.
Keep everyone in line in room 1.
Yeah.
Okay. And Lori, were you not assigned to a spot? But you're still muted.
Am I not in a room?
No, you're technically with us. Are we supposed to be in a room? No, I think you need to be in a room. Elisa's gonna work her magic. I can tell.
I
She's
think,
our-
Lori, do you have an option to go to another room? Does it telling you? Because it's telling me you're assigned, so I don't know how to physically
Yeah.
move.
I just did what I was told. I don't know
Is
how
it at the
I
top of
ended
your-
up where. Am I supposed? I can leave. Do you want me to just
No.
leave?
No, we don't.
No,
want you to
no.
leave.
Can leave.
I was
No one can leave.
obeying, but I can leave.
No, thank you. And thank you for staying.
Lori, I'm gonna try and assign you somewhere else and see if it asks you to move.
Okay.
I
sure.
don't know.
Yeah, whatever. You'll
Thank
move
you.
into your
Sticking
side
around.
room in 10 seconds. Okay.
There we
Success.
go.
Look at
Okay.
that. Anyway,
Uh,
what were we saying? Oh, that Carol is a professional, and yeah,
I feel like I always run through it though, and then I'm like, shoot, I should have said this and this and this.
no,
And
that always
this.
happens. That's why we're
Yeah.
all here listening and
Yeah.
embellishing. I think it's and it's a little bit of a different audience,
Yeah.
So
Yes.
what I really want to say at the end here, and I could say it or you can, is the task at hand for these medical systems is to identify someone in the practice that wants to be an early childhood champion.
Mhm.
Because if they could find a human, then that person can build these bridges.
Yeah.
And I would suggest that they could be the person that calls over to the parent-child center to say, hey, what do you think we should do about our partnership? Should we meet monthly? Should we at least just meet once? And I'm your person. My name
Yeah.
is Jim
Yeah.
Dewsman. Because what you can feel when you present like this, Carol, is it is a complex system.
Yes.
As much as we know it and think,
Yeah.
there's four
Yeah.
components to CIS. Well, yeah, except each one of
They're
them
so
has
confusing. Yeah. Yeah.
some federal, entitlement, a little bit of eligibility,
Yeah.
and then
Yeah.
a little bit what you did a beautiful job addressing the squish, right? Because
Yeah.
we all know what really happens, but you can't represent that.
Yeah. For sure.
And then what's Sarah Morgan, by the way, is this incredible
So
family practitioner at Hardwick.
So Sarah I didn't want to call Sarah out, but Sarah has gone on a home visit with me when I first was doing early intervention. Like Sarah was
Amazing.
like, I want to come out to see this family with you. And I was like, oh, okay. And it was like my first year, I think, doing EI, maybe second year. So, I mean, and Sarah's the only doctor who's ever said, can I come out on a visit?
No, she's remarkable.
Yeah.
She actually just got trained to do autism assessment in primary care. I mean,
Oh, that's great.
yeah.
I don't think we knew that.
Well, I don't know if she's telling people that yet, but I mean, I'm sure she is because she's seen several kids.
You
That's
just
an
told
interesting.
the wrong person. Now I'm all
Well,
over
I'm
it.
thinking of your geography. Yeah, that's cool. I was
Sarah's our
picturing.
region. And that's, I mean, she's completely right about how, like, they're Hardwick. So some people don't think of Hardwick being Lamoille Family Center, but we
Yeah.
cover Lamoille Valley, not just Lamoille County. So it is very confusing. I have to constantly double check like what our towns are.
Well, and that's why it's okay to say it doesn't always work. If you're a busy clinician and you send someone off to Orange County Parent Child Center and then you
Yeah.
never hear back, it's probably because it was the wrong one.
Right.
And what I like to promise my medical colleagues is that the place you send them will figure it out, but that's not everyone shows up exactly like you do, Carol. You know what I'm
Yeah.
saying? Like it's a little
Yeah.
less.
I know.
It's
Yeah.
and my story gets very old for people, which is for any kind of developmental concern. I called the school district, and if the kid was under 3, that person knew to send them. Like would just be like, Brina's a dingus.
Yeah. Yeah.
I called 382-1279 for every problem I had. And the woman still, I run into her sometimes, Kathy Reynolds, and she'd be like, oh, thanks for the referral, Brina. And then she would move it to the right person.
Yeah.
Which is what Help Me Grow is trying to do. I mean, I think.
Yeah. Well, and I
Yeah, I
think
just,
that's
yeah.
I think that's a thing too, like thinking about CIS or anything, like you don't have to decide what program you're sending somebody to. Just call over or make a referral and we can sort that out with a family. Like just get them over. Yeah.
But what's cool about that, Carol, that's true. But it only feels good to an obsessional, hardworking pediatrician if they hear back. Because the number one quality in pediatrics is an overdeveloped sense of responsibility.
Yeah.
And these people don't go to bed at night when they feel like something's dangling.
Yeah. Yeah.
And what I always say to folks is you want that in your physician, right? If a person goes to bed and your lab shows you have leukemia and nobody's checking, that's a terrible quality. This whole like, just relax, I'll check tomorrow.
Right.
And I watch it with adult medicine. They're just not as attentive to the doubling back. Like they send you off for the labs and nobody calls you for a week, so so sending someone over to CIS and not hearing back sounds silly, but it's deep. It's a deep.
Yeah. Well,
And-
there used to be, I think before CIS got bigger, there were like, at least here in Lemoyle, and I think other places too, there were sort of like referral follow-ups sent. And I think that's one of those things in Lemoyle we're working on, trying to figure out how to better track, not just CIS, but like wide with this new Find Help tool, referral tool that we have.
Well, and I've done a lot of work on this, Carol. The number one reason they don't call back is the parent didn't consent.
Yes, yeah.
Which is awkward because in medical referral, you don't need consent. You know, if I send someone to Tom Lahiri,
right.
he tells me what the patient's asthma is doing. It's not like that you had to say whether you could call Brina. Do you know what I'm saying?
Yeah.
So if I send someone over to you and you say, yeah, sorry, I can't tell you what we ended up doing because the parent didn't consent, that just feels like, yeah, but I sent them to you.
Yeah, totally.
But Elisa has her hand up.
Well, should I give like a 2-minute warning?
Yeah.
Yes.
Okay.
They're probably, I'll be so curious to see how many people come back.
26.
What you think? Can you tell 26 or that's your
No,
guess?
I'm being funny. I like to guess. I like
games.
Okay.
Because 10 minutes can feel like a long time. Like they had to do introductions. And how big were these groups?
Well, it turned out I'm really bad at assigning. So some have 8 and some have 4.
Okay, so like the
most
fours
of them
are
have like 5 or 6.
Okay, all right.
I think you're doing great.
Assigning, like they do this like random generation, but as more people come in, you have to assign them. And I was like, oh, I'll just assign them to room 3, which I did over and over again. Oh, look, they're closed. It closed by itself. So they're coming back now.
Okay.
Rena, there are 26 people.
Rena, that's right. We could have wagered, but we wouldn't have done that.
Yeah, I have, spidey sense.
Rena guessed 26.
Look, Sarah Morgan's on camera. Hi, Sarah Morgan. Yay. Keep those questions coming, Sarah.
Yeah, they are good questions. Thank you.
They, we're the first to admit it's not a simple system. Eligibility and otherwise.
Elisa, everyone is back now, we think?
Let me check.
Everyone who didn't bail on us, that is, the 26 champions for the day. You all should take the rest of the afternoon off for coming back. I'm just kidding. I know you probably can't do that. Why don't you take the next 2 days off? How about that? I'll wait for Elisa to give me the go ahead.
I think that all the rooms are closed. So yeah.
Okay, perfect. Thank you. And thank you all. You're the true champions for making it back. If you were voluntold that you were going to have to report out, if you could just raise your hand and then I will call on you. So we're hoping to hear sort of what's working well in your region or your regions and what's been challenging and what ideas you have. And Brina, I know, had thrown in another question there. So I will start with number 1 was Michelle. Michelle, you had your hand up first. If you wouldn't mind sharing out. Thank you.
All right. I was in a group with Carrie and Gretchen. And so in Lemoyle, of course, Dulce is working well. And so it's getting all the contacts made and such. And it's very common that there's just not enough practitioners to meet all of the needs. And so we did not address the third question. I did not see that.
Okay, no pressure. That's right. And when you say not enough providers in the early childhood system or medical, give me a little more.
So kind of like OT, speech, PT, getting in the home, working with the children.
Yeah.
Housing is an issue everywhere. Yeah.
Awesome. Thank you, Michelle. John, you're up next.
Sure. So I was with Paul from Rutland, Lindsay from Ottaquechee Health Center in Woodstock, and John, who is in the MOUD part of Blueprint. But in terms of what Paul, you had said, and Paul, please correct me, or Lindsay, you too, there's regular meetings. Actually, the Blueprint has a specific pediatric team in Rutland, and they meet weekly with their partners in pediatric care to connect over all different types of referrals to all the different community partners, including their parent-child centers, their VNAs. And then I guess one of the things that Paul brought up was really looking to enhance support, training, and prevention of burnout for frontline workers who can just have lots of content areas of expertise, a lot of trauma and vicarious trauma combined. So that was Paul. That's a very short summary. And then Lindsay is a social worker at Ottaquechee Health Center, who's part of the Blueprint. She's worked with the Dulce Family Specialist. She works well with both parent-child centers that cover her territory, and felt like having more structure in meetings. And Lindsay, I'm sorry, I can't really expand on that, but felt that would be helpful. So yeah, thank you.
Awesome. Thank you, John. And Lindsay, I don't know if you're here, and if you want to expand at all, you can, but you certainly, no pressure. You do not have to. One person's left. Maybe it was Lindsay. I'm not calling Lindsay out. Maybe it wasn't Lindsay. Others. There must have been other people who are going to be spokespeople for their groups.
Hey, Carol.
Oh,
I can speak. We didn't have a specific report out person, but so I'm Julie. I work at VCHIP, but I also spoke with somebody from Lily from Mount Ascutney and Katie from Hardwick. And I think one of the things that we talked about that was working really well was Mount Ascutney, which is a Dulce site, and talking about the family specialists there, really being able to make the wonderful connections because of the, being so embedded, that felt like there was no balls were ever dropped. And so that was like, wonderful. And then conversely, sort of hearing about some opportunities to sort of understand more about, like, when you send somebody off to CIS, what happens. So sometimes not hearing back, in other regions around, like, what, did the family go, was the family helped? Were they supported? How can we in the primary care practice then support them more, or do we need to help them find new or different resources? So that referral loop closure that we hear about a lot in primary care.
Awesome. Thank you. Dr. Morgan, you are up next.
So I spoke mostly with Jen, who's also a family specialist with Dulce and Lamoille County, and definitely had a little bit of jealousy listening to how well that works and having an embedded family specialist in the office. And I think just through this last hour, I've been realizing that I think identifying you suggested earlier, maybe identifying a staff person amongst our staff, maybe Katie, who's on the call too, to sort of be the person who really gets to know all of these family centers that we work with and can liaison with them and remind all of my colleagues some of what I've learned today about, hey, you can refer to CIS for more than just early intervention, and just, work on improving the communication in both directions. So I hope that we can move forward towards something like that.
We could basically end the presentation now, because Dr. Morgan just revealed what we're secretly hoping for is that all of your practices will sort of pick up key person who can then make that connection with a PCC, with a CIS coordinator, so that, we build those relationships amongst each other, and then we can continue to support families together, which is great. So Dr. Morgan, you should take the weekend off.
Now we wish there were prizes. Well, and Sarah, there's so much here in the concepts of team-based care. We have such complex healthcare delivery needs every day. And I think for some aspects of child health care, we figured it out, right? Like, we all had someone in the office that could really teach how to use an MDI with all our kids that had asthma. And we knew somebody that was particularly good with the teenagers. And so what we're really looking for here is someone in your practices who it has a special interest in early childhood, and then will hold the system for you, because we're not pretending it isn't complex. The system, when you see it all out in slides like that, it's like, oh, right. Uh-oh. It is a lot of pieces, a lot of funding. It's stuff we don't think you need to hold. We would just like someone in your office to call to be the liaison to the parent-child center, and that's relational. So thanks for that.
Yeah, awesome. Rachel, you had your hand up at one point. Did you want to report out?
I can. We also didn't assign an official report out person, but we learned in our group, we had Helena from Springfield on, a community health worker, and her partner, I can't remember her name. And they shared about this mobile unit that they have. She's at a FQHC, and they go out in that with someone from the Springfield Area Parent-Child Center and go to places. And I think you should probably say this, Helena, instead of me, but they had 10 community partners involved in one of these outings. So they do it once a month or twice a month. But it sounds like they're really bringing community partners together to go out to where families are at and visiting different locations in that city. Sounded very cool. We didn't answer the other questions.
Awesome. Thank you, Rachel. Anyone else want to add anything? Any other spokespeople I missed? I can't see how many people there are. Is that because there's so few now that I can't judge the numbers? How disappointing that I've lost that power.
No, we're at 25. There's 2 screens, Carol. I promise you haven't lost that many.
Okay, phew. Okay, good. So one, this is great. Like, I've taken note of a couple things that at one point we used to send more referral follow-ups here. And I think as numbers have increased, that's fallen by the wayside a little bit. And so how do we do that? And how do we, as a parent-child center, continue to make sure we're doing our part to support all of you? So this has really been selfishly helpful for me. So thank you. I took some notes. And again, like we said, to have someone at each of your agencies sort of pinpoint who can be that liaison between the PCC and others is fabulous. So I love that Dr. Morgan said that. So thank you. The next slide I'm gonna do. Bloop, 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 bloop. This is how fast we are. Can you imagine if I went through it that fast? That would have been exhausting for all of you. We are at the question phase of this. If we have time for that, do folks have questions? Burning questions that we didn't answer?